So Mr. Anand, a hard-working man having the transport business in his mid-40, he visited to medicine OPD with the complaint of increased frequency of micturition day and night. He did not took any harmful medications such as NSAIDs, analgesics or any herbal medicines. Neither he has gone through any abnormal incident recently. So on general examination, we found that the color of his skin and the conjunctiva was pale and also there was swelling present in both his legs, जिसे हम मेडिकल नॉमेनक्लेचर में बोलते हैं bilateral pedal edema. So on routine investigation, we found that Mr. Anand is anemic and his kidney function test is highly deranged. There is increased level of serum urea and there is increased level of serum creatinine. Next, the ultrasonography of the kidney, ureter and bladder was done, revealing the damage occurring in both of his kidney and doctor suggesting him to undergo dialysis as soon as possible. And if possible, he has to go through kidney transplantation. So what was wrong with Mr. Anand that he has landed up on this situation? We will find out in the second episode of our series, The Patient Tales. So hey everyone, welcome back to MedicoX. This is Dr. Devkumar Sahu, currently an MBBS intern working at GMC Jagdalpur, Chhattisgarh. So with great enthusiasm, I am here presenting you the most serious story of a man, assuming that this story will be helpful in understanding the disease progress and the severity of the same. I create such videos in regards to general community, the patient tells, story of the patients by themselves. So here let's dive into the second episode of our series, The Silent Killer. So 2 years back, it all became innocently with some occasional fatigue and unquenchable thirst. Ignoring the signs initially, Anand's world shifted when routine checkup revealed that there was elevated random blood sugar in his blood. It was 230 mg per deciliter, and we know that the normal range of the random blood sugar is below 200 mg per deciliter. If it is more than 200 mg per deciliter, it is considered as uncontrolled blood sugar level. So all these things revealing that our patient has developed diabetes mellitus type 2. I'm pretty sure that there will be at least one people in your surrounding who would be suffering with this silent killer. It is a kind of poison which kills insidiously. So it is our responsibility to understand the disease and to make the community aware about such harmful conditions. So Anand's journey into the field of diabetes management started with lifestyle modification, dietary changes and regular exercises. At first, these adjustments seemed to be manageable and Mr. Anand embraced them with his determined spirit. However, as the time unzipped its chapter, the insidious nature of diabetes began to reveal itself. So Mr. Anand started experiencing burning and tingling sensation in his feet. He started feeling numbness in the extremities. Now every step was a reminder of the hard battle within the body. Seeking consolation in the regular visits to the endocrinologist, Mr. Anand learned about the different potential consequences of diabetes. Vision impairment was the next adversary in his journey. Blurred visions clouded the once vibrant color of his surrounding. Frustrations and fear gripped Anand as he captured into the realization that diabetes was encroaching on his sensory world. The once crystal clear vision of his future was now distorted. Mistake that Anand does with himself was that he did not take medicines properly. He preferred listening to general community rather than his doctor. Unfortunately, he landed on the most serious complication of the diabetes, that is diabetic nephropathy, which leads to chronic kidney disease. Here you must focus that why I am calling this disease as a silent killer, because one by one this disease tends to involve all the vital organ of the body. So at last, with the support of his family, his wife and the health worker team, he was immersed deeper into the complicated part of diabetes management. Insulin therapy, medications adjustment and meticulous monitoring of the random blood sugar was the integral part of his routine life. The resilience that defined the Anand's character became his guiding light in the face of this bad situation. Now as he has lost his both kidney, the only way of survival is to go for kidney transplantation or he can go for hemodialysis 2 to 3 times per week. And we know that the kidney is also responsible for releasing the hormone erythropoietin. This erythropoietin hormone is a stimulating agent for blood formation. So in the renal failure condition, there is no erythropoietin hormone, there is no blood formation. So the patient is pale, having the anemia. So in this condition, Mr. Anand has to inject the erythropoietin exogenously. The journey was marked by setbacks and many small victories. Slowly but steadily, the tingling sensation started diminishing and the vision became too clear. Anand's commitment to managing his diabetes transformed his narratives. Currently, he is on regular anti-diabetic medications and he says that he will never take diabetes lightly. And he also suggests other people to take care of their uncontrolled blood sugar level. Beside this story, I will tell you some more complications of diabetes. Diabetes is responsible for increased risk of infection. It leads to darkening of the skin, and also if there is any injury, it takes longer time to heal than usual. I hope that this story can teach the community about the silent killer, the diabetes. I do create videos on such topics. It will be worth it if you just click the subscribe button and share this video with your friends. All the huge amount of time that I have given to this video will be paid off. We will become the testimony of many cases under the series The Patient Tales. I will see you soon in another video with another topic. Till then, stay happy, stay motivated, and help old people's controlling their blood sugar. Let's be a Medico X. It's Dr. Devkumar Sahu signing off. Thank you everyone.